Thank you again for all the speakers for this excellent presentation. There are a lot of ethical questions. Question by Dr. Al-Jazia. Thank you, Dr. Al-Jazia. He is commenting about labeling medication is a regulatory agency job.
Okay, Dr. Jazia, he's asking about the off-label drugs. He said there is no dark and white, and this is a job of the regulatory agencies. And I think he needs your elaboration in this.
Yes, I'm glad to hear that from Dr. Jazia specifically, because he used to be, as a dear colleague of mine, and he used to be a member of the IRB at the National Guard Hospital in King Abdulaziz Medical City in Riyadh. And I'm glad to hear from him at last. Yes, it is a very good question, and it is based on the principle of who is and who isn't responsible for addressing this off-label issue. And in our country, that's probably the main reason I brought this up, because there is not clear-cut regulation guidelines to address this. And that's probably why things have gone out of hand in terms of off-label use of this chloroquine and all this stuff that the rest of the world, most of the rest of the world are not putting on their list. So probably if Dr. Jazia would maybe come up with a suggestion or a proposal that could be sent forth to Saudi Health Council, that should be regulated. That should be regulated. Yes, I agree with him.
The second question, in the case of crisis, would Sharia prevent the physician from disconnecting a patient on a ventilator who has a worse prognosis or brain death?
Well, I've addressed that point brief, Dr. Ali. Thank you for the question. I don't know who sent that question, but it seems to be relevant, very relevant to what I'm saying. I alluded to that when I mentioned Dr. Tariq Angawi in one of the last slides of mine, and it is still disputable because it's very difficult in some situations where and when to disconnect respirators or ventilators of patients. It's been said that there are criteria for telling the attending physician who gets first. But that's very difficult in situations like COVID-19, as the healthcare teams faced in our part of the world. And I said in probably the before last slide of mine that needs to be further studied and clarified. The final word is it's not allowed to withdraw ventilators from patients if that's a big if. It is understandable that would lead to the patient's death. It's not permissible as per Sharia. That's right.
Thank you, Prof. Thank you, everybody. Unfortunately, we are run out of time. There are too many questions, but unfortunately, we cannot take them. I'd like by the end of the session will be sent to the speakers and communicated with those who ask these questions. By the end of the session, I'd like to thank all of the speakers, and without further delay, I will move to the next session. Thank you so much.